All right, we're gonna get started here. I have my patient. We're gonna do a sweep of the room to make sure there's no notes or posters at all. Hello, my name is Monica. I'll be your student nurse today. I'm gonna close the curtain for privacy, wash my hands, put on some gloves. Can you tell me your name and date of birth?
My name is Julius Quinn and I was born on July 1st, 2007.
Okay, thank you. Do you have any allergies?
None that I know of.
Alright, I'm going to check your wristband to make sure that's correct, which it is. And I'm going to verify my physician's orders here. It looks like he wants me to do a respiratory assessment on you today, so we'll give you your lungs a listen. Would that be okay? Alright, and are you sitting in a comfortable position?
Yeah.
Alright. So I have my necessary equipment here, my stethoscope, and it has been disinfected. Can I have you take off your shirt just because it's easier to get to and easier to listen? Not supposed to listen over clothing. We might pick up sounds that aren't there. Right, before I get started, I'm going to ask you 3 health history questions. Do you have any chest pain ever?
No.
Okay. Do you have asthma?
No.
And do you smoke or use e-cigarettes at all?
No.
Oh, okay, good. I'm going to check your respirations and your effort to breathe here, so I'll just have you breathe normally for me, please. I'm going to start on the 10. Alright, I got 20 for your respirations, which is within normal range. Normal range is between 12 and 20, so that's good. Your effort to breathe looked good. Didn't look like you were struggling to breathe at all or using your accessory muscles to breathe at all either. I'm going to check your AP to lateral ratio here. So normal AP lateral ratio should be 1 to 2. So 1 front should equal 2 of the sides. So that looks good. I'm gonna palpate your chest for any tenderness or masses or crepitus at all. I'm gonna check your anterior, your lateral, and your posterior. Did that hurt when I was pressing on that at all? Okay, that's good. And I didn't feel any masses or lumps or bumps at all. So that's good. And I'm gonna palpate your trachea here. Should be midline, which it is. Not off to one side or the other, so that's good. I'm also gonna check your skin color. Looks good. Temperature looks good. I don't see any lesions, or I didn't feel any masses at all, so that's good. I'm gonna check your chest excursion, so I'll have you take a deep breath in and out for me. All right. Check the posterior as well. Okay, and that looked nice and symmetrical, equal bilaterally. My your lungs seem to inflate equal on both sides, so that's good. And I'm gonna use the palms of my hands, and I'm gonna check for tactile firmness. So I'll have you say 99.
99, 99, 99.
All right, I'm gonna do the posterior as well here.
99, 99, 99.
Okay, and that all felt good. Equal vibrations, symmetrical and equal bilaterally, so that's good. I'm gonna go ahead and give a listen to you here. So there's 18 spots on the back, and I'll have you take nice, slow, deep breaths in and out through your mouth. Repeating your breaths every time I put the stethoscope down here, and I'm gonna use the diaphragm side. So those all sounded nice and normal. Clear lung sounds, equal bilaterally, no abnormal sounds, no wheezing or rails or crackles at all. So I'm going to give your front a listen here, and there's 10 sounds on the front. So again, I'm going to use the diaphragm side, and I'll have you take nice, slow, deep breaths in and out through your mouth, repeating your breaths every time I put my stethoscope down. Again, good, nice, clear lung sounds, equal bilaterally, no abnormal sounds, like no rails, cracking, or wheezing at all, so that's good. Your coastal angle looks good as well, less than 90 degrees, which is normal, so that's good. I'm going to document for facility policy and update the physician as needed. Is there anything else I can do for you while I have the time?
No, thank you.
All right, thank you. Have a good day.
You too.